And so one of the important things to identify is during this immune activation process, when our bodies are making antibodies, they also make cells called memory cells. And these memory cells then have the capability of immediately producing these spike antibodies whenever they come, if there's an exposure. So somebody gets vaccinated, they get exposed to COVID, they already have antibodies. And so that COVID virus then tries to get into the body, but the antibodies are essentially are sort of waiting for it and are able to glom onto the viruses, and then they get destroyed by the rest of the immune system. It's a very highly effective system, very, very targeted to just this coronavirus spike protein, which is actually the spike protein that all the variants also have. So I saw that there was a question about this, and I'm just going to go back and look at it here. Excellent. So there was a question about the data, because they can't find this mRNA anywhere else. So it's gone from the body in about 2 days. And so they've never been able to find any of this mRNA. And mRNA cannot affect other, it only goes to ribosomes and makes proteins. And so there's been some concern, and it's all theoretical to date, that the spike protein might mimic something having to do with immune disease. It has not been proven to be true yet. So they've looked for this a lot in folks who have been vaccinated. They follow their antibodies, they follow what their immune systems are doing, and they have not been able to identify any other organ that's affected by this. So that's very important. So this vaccine is quite unusual. Many of the other vaccines we have, like measles, mumps, and rubella, they're a live virus vaccine, and they do get into a variety of tissues as part of their immune process. But of course, their immunity is so robust that you only have to be vaccinated just the one time, the 2 times when you're a kid, and then it lasts for life. This one is very, very targeted to just this COVID-19. It has not been shown to cause any other damage in the long-term follow-ups that have been done on vaccine recipients. And I will get into a little bit of that, because when I say follow-up, I'm actually talking about the first 30,000 or so that went through the vaccine trials. So the other concern from people is that when it got developed so fast that we skipped steps. No. With the technology being there and the sequencing being there and marrying those up very rapidly, then the clinical trials started quite rapidly. And because these vaccines are given to healthy people, they have to be safe. They have to be safe. So 30,000 people were immunized, half with placebo, half with the vaccine, and they looked, that's in one trial, and then 30,000 in the other trial, the 2 different kinds of mRNAs and the J&J. And then they followed those folks who had the very first doses. How did they do? How were they protected? What was 1 dose versus 2 doses? So that's how we got the 2 doses initially, because it's better. And then follow them along to see how things go, and to periodically do evaluations to make sure that all the rest of their bodies are okay. As you know, there was concern about infertility. Well, women have gotten pregnant after vaccination. They were pregnant while they got vaccinated. And now we actually know that pregnancy is a high risk for bad COVID disease. And so the current recommendation is for pregnant women to get vaccinated during their 3rd trimester so that they won't get a bad case of COVID. And also they pass on the antibody to their babies. So that's really been shown over again that there's no risk with infertility. And this is just a very unique vaccine. It goes away in 2 days. So I think there was another little question here. So I'm just going to go real fast and look it up. All right. So the J&J is different. The J&J uses an adenovirus vector. This is a virus that we've known about for years. This is a technology that's been used in humans for many years. And they just put a piece of the COVID virus in there. And what it does is the virus actually delivers this RNA to the cell rather than it just being a piece of mRNA, and that's how it stimulates immunity. So it's different, and but it does result in the same sort of process of having immune cells activated and producing antibody. So different technologies, still the clinical trials had to show two things. They had to show, one, that it was effective, and two, that it was safe. And so the effectiveness part is, did it protect you from getting sick? Did it protect you from getting hospitalized? Did it protect you from dying? Those were the three major things. And oh, by the way, did it protect you from getting infected? And so with the first COVID-19 type, the alpha variant, as they call it, it was actually effective in preventing infection, but it definitely had a huge effect on illness, hospitalizations, and death, to a 99% protection, which was huge and unknown for vaccines, basically. I mean, that was amazing. And so they really did look at those outcomes. Was it effective, and was it safe? Now, the safety data, that's what I've been talking about. What does it cause? Well, we know when you get the vaccine, your arm hurts. Absolutely, undoubtedly, it hurts. When I had mine, it hurt. And it didn't take very long before it didn't hurt, like one day, and it was fine. Some people feel a little feverish, they don't feel very good for a couple of days, and then it goes away. That's probably as bad as most of the reactions get. There are some very rare, more serious reactions that are very predictable in certain types of individuals. The one we worry about, of course, is anaphylaxis, which is a massive allergic infection, which can close off your windpipe. So that's one we really worry about. And indeed, some people have anaphylaxis to these vaccines. That is to be anticipated. We now know that there are ways to prime them so they can get their second vaccine. So that's the major real concern, because that can kill you pretty fast. The other major concern that has been identified as a blip are for young men who may get myocarditis. Now, they recently published in the MMWR, which is the CDC publication, that they looked at what is COVID-19 infection cause and what does the vaccine cause. And so the COVID infection is much more likely to cause myocarditis than the vaccine is. So if we're looking at relative risks, it's much safer to get the vaccine than it is to get the virus itself. And that's true of a lot of the different side effects that people were worried about. They're worse if you get the virus itself than if you get the vaccine. And we have now well over 375 million people who've been vaccinated just in the United States. So we have a very strong record-keeping system for this vaccine, best ever. We've never had this kind of excellent data to make sure it remains safe. Now, there was a question about the booster. So why are we talking about boosters? Okay, you guys are all relatively young, because if you're in the student age, you're young, and your immune systems are top-notch. And so your antibody production was really high to begin with, and it has stayed high because you have a good immune system. Now, once you hit like 60, this is sort of how it goes, your immune system ages and it doesn't work as well. And if you have any immunocompromising condition, like you have cancer, you're on chemotherapy, you have a genetic condition that your immune system's not very good, then you did not produce as much antibody to those first 2 doses. And so again, they've been following people out to see what their antibody levels look like, and they were starting to go down. And I'm sure you've probably seen in the headlines that they talk about Israel, because Israel has a very robust follow-up system as well. And so in Israel, they saw the same thing, that the antibody levels were coming down, and they worried that it was going to result in more infections. So they decided that it might be good to boost up in just selected individuals. So I think you saw last week, basically, that the CDC approved a booster dose of just the Pfizer. That was the first one that was approved, and that's the only one that's been approved for boosters. If you got your first series and you're over 65, or you have an immunocompromising condition, and there's a whole list of them and are vulnerable, then they recommend you get this booster so that your antibody levels will go way up and will help protect you. And that's not a bad idea during the winter when we are indoors more and there's a lot more exchange of respiratory viruses. So it makes a lot of sense. So there is no recommendation for booster in young, healthy, young adults and even mid-age adults. There's no recommendation for that booster because the immune systems generally, and this one in particular, is doing a good job. Okay, so I saw that there was another question here. Let me go to it. All right, I'm gonna go through these really fast. So I think we found out why did it take the FDA so long to approve the first vaccine, and which parts of the vaccine are approved and which ones are not. So all of the parts of the vaccine are approved. And what happened is the FDA has to look at all the clinical data, and they need 6 months of follow-up from the clinical trials before they feel comfortable with showing effectiveness and safety. So that's why they always take this long. Actually, they take longer. This is the fastest it's ever been approved. And that's because we've generated so much information so fast about its safety and effectiveness. All parts of the vaccine are approved. It's given exactly as manufactured. It is not a bit too soon to determine if there's no risk of infertility because they've looked at it. There is no infertility from the mRNA vaccines or the J&J vaccines. So if someone gets a vaccine, is it effective? Why is it still suggested for them to wear a mask? Okay, so this is a great question because what we know now is the Delta variant, which is a little bit different than the Alpha variant, it evades some antibodies. And so even though the Alpha variant, the vaccine stopped infection, the vaccine does not stop infection with the Delta variant because it's a little bit different. Now, what it does stop, it stops severe illness, it stops hospitalization, it stops death. I was just reading an article that showed that for people who are hospitalized with COVID-19, anywhere from 90 to 98% of them are unvaccinated. So clearly vaccinated folks are not getting significant disease. So there's enough immunity to keep them out of the hospital, keep them from getting really sick, and keep them from dying. So even though the Delta variant is more infectious, so that's why the mask recommendation is still there. They're required because people who are vaccinated can still get COVID, which means they can still transmit it. So remember, masks are for two reasons. Masks protect you and they protect others. And so in that two-way passage, potentially, that's why masks are still definitely required. And so I'm a huge proponent of masks. And I've been talking to my colleagues and we sort of laugh. We think we might do masks for crowded elevators, when we're in crowded rooms, in the wintertime, so we don't get influenza, because that's the next one that's coming, right? So masks are really, really effective in preventing infection and stopping transmission. So that's why we still have masks that are used, but that's a great question. All right. If you got the J&J vaccine, right now there is no recommendation to switch to an mRNA vaccine. So just wait. You have to be at least 6 months away from your last dose to be eligible for a booster. And if you only got one dose so far, you only needed the one dose of J&J. So there's no recommendation yet for a booster with J&J, but they are looking at that data right now, and then it gets submitted to the FDA, and the FDA scientists then begin to really look through it and make sure it's safe and effective before they would ever recommend approval. So stay tuned for what happens with J&J. So here's another very good question. If the vaccine helps to bring the symptoms down, but you can still get COVID with the vaccine, then couldn't it technically still attack your body, causing greater medical problems? No. So you get infected, but you have antibody. So it takes care of most of the virus. It just doesn't take care of all of the virus, but so you don't get significantly ill. There have been some deaths from vaccinated people with the Delta variant, and they were very vulnerable to begin with, very fragile and older. So that's why it's that's sort of why we worry about that, and why the masks are very important. That really, really helps. So I'm very careful. I've been vaccinated and I intend to get my booster. I got a Moderna. So like I have to wait until the Moderna data gets looked at by the FDA. Apparently that's going to go in this week, and then they will look at it very carefully. See, that's the part I think people really need to understand, is that the CDC and the FDA they're filled with scientists who know how to look at information and data, and they go through every single calculation. They look through the statistics, and that if they did it right, they look at all of that to make sure that it is safe and effective before they approve it. So that's why even the booster took a while. We heard about it a long time ago, but it took a while for it to actually be approved. And we should be happy about that. We have an agency that looks out for the safety and the effectiveness of medications and vaccines. And that's what the FDA does. So I know there was another question there. Okay. Okay, how is it determined about the variant? So our state public health lab here in Nevada actually sequences the viruses that are identified to look and see, what's Delta and what's Alpha. Almost all of them are Delta now. So we sort of assume almost everybody has Delta, but they can actually sequence it in some of the clinical labs and let you know. The masks are proven to be effective in a variety of experiments over and over again. There's probably about 20 of them now that show them to be effective in preventing transmission and from getting infected. So lots of information on that. Antibodies obtained through positive infection. Another great question. So there was a research study published recently that looked at vaccine immunity versus infection immunity. And vaccine immunity is much more robust, much higher antibody levels, much more effective antibodies than that which is produced by people who actually get infected. Now, it's sort of counterintuitive. However, because people get infected with a strain, antibodies don't always produce exactly the same antibodies. And so it may be much more specific just to the virus they got. So if they get exposed to another virus, it'll be a lot lower, but their antibodies levels are actually less. And I just think that's a very interesting finding. We don't usually see that with infectious disease where the vaccine antibodies are higher than the natural infection. But that's what's happened with COVID. Okay, I'm going to go look at your questions again. Keep them coming. No, the masks are not just effective for 15 minutes. No, that is incorrect, because COVID doesn't go out on water droplets. And so, and the water droplets, like in your exhaled breath, I think that's probably what you're referring to, really don't affect masks. If you're wearing them correctly, the real issue with masks is they leak around the sides. So a well-fitting mask is extraordinarily effective for hours and hours and hours and hours. So you don't need to worry about that 15 minutes. People are trying to, figure out like which masks are best. You can wear a fabric mask. That does help a lot. And if you put a little filter in there, it's really highly protective. I think we actually know that the N95s, which are the masks that other folks have used for years to filter out, like in hospitals for infectious things, they work the best. And you can actually buy those all over the place. N95. So those are even more protective. But the fabric masks actually reduce both what's inhaled and what's exhaled and reduce it. So, I think it's just that physical barrier that becomes very important, because the virus actually is smaller than any of the holes in the fabric, but it just doesn't get through in other than, minuscule areas outside the mask. So masks really do work, and all of them work. We do know, okay, long-term side effects. All right. So I think that's a really good question about long-term. So far we have well over a year. And again, those the folks who were in the clinical trials last year have been followed all along. They're looking to see their outcomes. They're saying, okay, at 6 months, what does this look like? At 12 months, what does this look like? At 18 months, what does this look like? So for some folks, we're up to 18 months already, and there have been no identified long-term effects. Remember, this vaccine does not enter anything to do with your DNA, nothing. All it goes into is these ribosomes, which are part of your cell, and make proteins. And these spike proteins have also not been associated with cancers. Now, could it down the road? Well, potentially, but we would already start seeing some signals, and there are no signals. They look at lymph node tissue, for example, in some of the recipients to see if there's any changes in the lymph node. There aren't. And so even though there may be concerns, it has not, to date, there are no serious long-term consequences that have been identified. Now, I am going to make you think about what happens if you get COVID, all right? So I'm assuming many of you probably heard of long COVID. Okay, so long COVID is what happens after you've recovered from COVID-19. Approximately 30 to 40% of all people, regardless of how severe or mild their initial infections were, have prolonged symptoms. It could be respiratory, it could be fatigue, it could be some neurologic symptoms. We're starting to see those now. Gastrointestinal, so they're having problems eating, and these have lasted up to a year in some cases. We actually don't know how long they're going to last yet, but clearly the majority lasts for 4 to 5 months. Long COVID is not fun. I mean, I have to tell you, that's what I worry about the most. I do not want to get infected because I don't want to have months and months of feeling terrible. And that's what COVID does. That does not happen with the vaccine. We already have that evidence in people who get vaccinated. They don't have these kind of symptoms for months and months afterwards. So I think it's a real clear pattern about risk and benefit. So I know people like to focus on the bad things that might happen with the vaccine, but you have to compare it to the bad things that actually do happen with the infection. And I think that's a really important consideration for you. Long term, they're going to continue to watch. And I think that's really, really important. Okay, let's see what we got here. Most of my sources are from the MMWR. That is the that is what CDC produces every single week. They're great. In addition, I also use JAMA, and I also use the New England Journal of Medicine, and I also use Lancet. So those are the ones I principally use when I'm looking at this kind of information. So hopefully that will help you as you look about this. Oh. Okay, so I have 2 questions here that is great. So one of them says, you're younger, you make great immune response, you tend to recover from COVID quite nicely. So why shouldn't you just get the infection? Okay, so 1, natural infection does not produce the same immunity as vaccine does. And that is true for young people as well. Secondly, you could get long COVID. You could get very sick. The interesting part of all of this is, with the exception of folks who have known chronic diseases, for example, diabetes, overweight, chronic lung disease, we know they have a much higher risk of bad outcomes with COVID. However, there's a whole group of young people who have died of COVID who had none of those kinds of symptoms. So it makes it very difficult to really truly identify who's going to get sick and who's not going to get sick. And so I think that's the problem with this. Like, why don't I just get it and get over it? You don't make the same immunity and you could get long COVID. I really wouldn't wish that on you for anybody. I have a number of colleagues who have kids who are suffering from this long COVID, and they can't go to school. And I would hate that to happen to you. So I'm an infectious disease physician. So for me, prevention is much, much, much better than trying to either cure or prevent bad outcomes. So this is a really easy way to prevent the possibility of getting seriously ill or getting long COVID. And I don't mean to scare you, but we have enough information now that that's my message. My kids are all vaccinated too. Okay, let me see what we got here. So very good question about long COVID in people, in vaccinated people who got infected. No, we don't have information yet. That's a relatively new phenomenon with the emergence of the Delta. And it does not appear to be quite common, but I don't have the statistics for you yet, but they're following those. So that'll be something really important to, okay, what exactly is long COVID? So for a subset of people, like I said, 30 to 40% of those who get infected with COVID, they have symptoms that continue well past the time where the initial infection, their infection's gone. They don't have virus around anymore. But as a response, their immune systems were strong enough and really had quite the response that they continue to have symptoms. So they're not infectious, there's no virus there, but they continue to have symptoms like fatigue. They do not test positive. No, they don't have virus around anymore. And so they have fatigue, they get neurologic symptoms, some people get gastrointestinal symptoms. They feel terrible. Some of them have these prolonged coughs that go on forever. So they're titling it long COVID, but there's a whole bunch of symptoms associated with it, and it is not due to continuing infection. The virus is gone. This is just the results of having the infection and having the body actually respond to the infection. So thanks for that question. That was a really good question too. Oh, the best argument. Okay, so let me think about that because I do read, I read a lot of anti-vax information. So here's the part that I really don't know how to take. So for example, in some of the literature written by folks who do not want this vaccine, they state that the pharmaceutical companies have a vested interest and that they actually pay for people to approve this and that there's corruption. Well, if that was true, that would be a pretty powerful argument. However, I know nothing about those things. What I do know is about the way the watchdog organizations, the government watchdog organizations work. So the Centers for Disease Control and Prevention, staffed by scientists, they use data, they look for data, they collect data. They really are very, very serious about that. And they would never, ever approve anything they worried about, even if they were pressured to do so. That they get to be a watchdog agency because they're objective. Same for the FDA, although there's closer ties with pharmaceutical agencies there. They have their scientists, they do things, but it's a double approach, two different organizations looking at the data very seriously. And I feel that that really helps overcome the potential for bias and for corruption in terms of that. The other science that comes out has just not proven to be true. So I haven't seen any strong arguments against the science. Okay, let me go here. Let me see. There's some more cool stuff here. So would I recommend a vaccine for children 5 or older? Yes, as soon as the information is looked at and vetted by the CDC and the FDA, yes. Now, I will tell you the data is already out. And they're using much smaller doses for children. So they're dose adjusted for the size of kids. And they're doing a great job, very, very, very few side effects. Kids do great with vaccines and a lot of antibody, as you might expect. If young people get the new booster, is that just extra protection for us? Potentially, but at this point, I don't think you need it because most of you probably haven't been vaccinated for longer than 6 months. So I just don't think it's going to be useful until and unless we have a more potent variant that comes out. And I'm going to talk about that sort of as I finish up some of this. Why is COVID-19 and becoming vaccinated a greater concern? Okay, so that's a really, really good question. The reason this is a real concern, and I think this is very important, is that COVID-19, so when it was discovered, and there's still some debate about where it came from. Most likely it was natural, because coronaviruses mutate readily. They're like influenza, they mutate readily. And so they're able to move from animal vectors or bug vectors to humans as they mutate. So most likely this was a natural mutation that made it able to actually infect humans, not just animals. And so that's sort of the evolution, just like influenza does the same thing. That's so we have to have flu vaccines every year, is because the influenza virus it mutates like that. So why is it more important now with COVID-19? So when it started, nobody in the world had ever been infected with it at all, which means that everybody was susceptible. And so if you looked at the percentages that we now know, we didn't know at the time, that how many people would get really sick, how many people would need hospitalization. The major concern was we would overwhelm our healthcare facilities rapidly. That's why we had to institute such rigorous mitigation measures early, stay home. We had to, because the hospitals were running out of beds. People who had cancer could not get surgery. People who had heart attacks had to wait in the emergency room. I mean, so that's what happens. And so for us, this was all about the capacity of our healthcare system to continue to care for all the other illnesses in addition to COVID that we had. So that's why we had huge mitigation measures right at the beginning, so that we had healthcare still available. That's why the vaccine was fast-tracked in the sense of trying to get people going. And once it was here, is please get vaccinated, please get vaccinated. We can't afford to have the surges. Look what happens. Delta happened. Delta is more transmissible and has a more severe outcome than the Alpha variant. That's why we have so many unvaccinated people in the hospitals, crowding ICUs. There are ICUs that are so full that people are getting transported and they die in transport. So this is not hypothetical. This is real. And so these major surges overwhelm our emergency rooms, our ICUs. They overwhelm the number of people we have. We've had so many healthcare providers just stop working because they are burned out. And so it's really, really critical to identify why we're getting vaccine. 1, it's for us. 2, it's for our families. 3, it's for our communities. And 4, it's so that we can continue to function and take care of all people who are ill. So I think that's a really important question. Unlike influenza, which is less likely to cause severe disease, because most of us have had influenza before, so we have milder infections. It does not do the same thing. COVID, because it was new, actually really, truly overwhelmed everything. Well, everything. We will find out if babies were going to get vaccinated, but not right now. Let's see, has confirmed that the test must be changed by 12/31 of this year. What will the changes look like? You know what? I'm not familiar exactly what this is, but I think it has to do with antigen testing and PCR testing and looking at new limits. Because right now the PCR test is so sensitive, it picks up people who have enough virus that it might make them a little sick, but it won't make them infectious. And so what they're really looking at is a standardized test that will pick up people who are going to be infectious, because that's really what we need. We don't need to know everybody who might have a little virus hanging around. We really want to know who's infectious. And that all has to do with how much virus is present in a respiratory tract. Okay, so I don't know how to answer the corruption one. I believe that we have enough layers of consideration, peer review, articles that get published in high level are already peer reviewed by 3 or 4 different reviewers from all over. That's what we do to try to keep things from being corrupted. And so, and the government has transparency. They have to give us information. So I think there's a lot of ways that we're trying to not have that happen. Can it happen? Absolutely, but I don't think it's happening now. All right, great question. So what's going to happen in the future with coronavirus? So I think you're exactly right. I think it's going to be just like the flu. I think it's with us forever. I think it will mutate. It might mutate yearly. Maybe it'll be less than that. And until and unless, because we may already have a fairly good vaccine that can handle multiple variants, we may have to get a shot just like influenza every year because it mutates too much for the immunity that we all have. So I get my influenza vaccine every year. I'm sort of embarrassed to tell you that the reason I do is about 20 years ago, I got influenza and I got really sick and I got a secondary infection. I was out for 2 weeks. I was absolutely miserable. I will never do that again. So I get my influenza vaccine every year because I took care of AIDS patients. I also get the influenza vaccine for them. And I would have no problems getting a flu coronavirus vaccine every year, just to make sure I don't get really sick, because that's what the influenza vaccine does now. It does not prevent infection, but it prevents severe illness and hospitalization. So with these RNA viruses, that's sort of the best that we can do. But guess what? That's huge. If you don't have to go to the hospital, you don't clog up the system, then we're able to continue to take care of all the other things that we have: car accidents, cancer, heart attacks, strokes. We need our hospital facilities available for those. So that's a great question. So I think that's what's going to happen. It'll become endemic. We still don't know how long our current vaccine will be effective. It may be longer than we think because they made a pretty big spike protein that had a lot of proteins on it. So maybe that's going to keep us healthier for longer. I would hope so. I would like that a lot. Okay, let's see if we've got it there. All right. Okay, so I think I hope I answered everything. Okay, so, I'm hoping that you all will get vaccinated for yourselves, for your families, for your classmates, for your teachers, for your community, because it really does reduce that risk substantially. Now, there are some people who cannot get vaccinated legitimately. They may have anaphylaxis. They may have conditions that make it impossible for them to make any immunity at all. I mean, we're really seeing that with those who are immunocompromised. I mean, we do a lot of things for the folks in our midst who may have bad asthma and have to be on steroids all the time. They're at high risk for all sorts of things, and we want to be able to keep them safe. Our grandparents, our parents, they may be frail, they may be fragile. We certainly don't want to get them sick. And we don't want to get each other sick. And for you all, although the probability is that you would get a mild disease, it's not guaranteed. And even a mild disease can get those longer symptoms. So I would not wish that on anybody. The vaccine is pretty easy to take. Again, it's really important to recognize what the side effects are. Your arm will be sore. It will do that, just like every other vaccine. And you may feel sort of crappy for a couple days. Sometimes that happens with other vaccines as well. Those are absolute normal side effects. And the way I like to think about it is it lets you know that your body is actually making antibody to all of this. And so it's taking, the vaccine is taking, it's doing what it's supposed to do. And so you get those kinds of side effects. Rare side effects can occur, and they're very rare. Okay, I saw that there's another question. Good questions, folks. So there's this two-part question. Why are potential treatment options so controversial? Why isn't information on boosting immune systems through other means more widespread? Okay, so they did a very long study that was just published that showed that vitamin D really didn't do much of anything. So they are doing those studies to look at, is there anything that we can do to boost the immune system? Now, part of the problem with COVID is that people who have an extremely active immune response to them actually get worse symptoms. So part of infectious disease is sort of interesting. Sometimes the infectious diseases that you get cause damage, but a lot of the symptoms we get, like fever and achy muscles, that's from our body responding to the viruses or the bacteria. So our bodies respond very robustly, and in that process, it generates chemicals that raise our temperature, makes us feel crappy, and that's part of our immune response. So boosting that may not be the best thing in terms of improving outcomes, and they have done that. Now, right now, they are using a monoclonal antibody. So this is an antibody to COVID-19 that is made outside the body and purified and can be given to folks who have exposures that are at high risk. And what that has been shown to do is reduce hospitalizations. It's not a treatment, it's a prevention, which is very interesting to me. So it has to be done very early before they get sick, because it doesn't make any difference afterwards to get this antibody. So, we do have some information about immune therapies. Now let's talk about the two unproven therapies that folks got pretty excited about. Hydroxychloroquine does not work, Multiple double-blind, placebo-controlled trials. And when you're looking at clinical trials, you need to make sure they are placebo-controlled and they're double-blind, because people can feel better for a variety of reasons. And so you don't want them to know what they got, because that can bias your observations. So it needs to be double-blind, so people don't know what they get, placebo-controlled, they either get the active agent or the placebo, and then following outcomes. Hydroxychloroquine did not help anything. It did not make people better who were sick. It did not prevent COVID-19. It did not work. And indeed, it caused side effects in a number of people that made them quite ill. So hydroxychloroquine was subjected to clinical randomized trials. It did not work. Ivermectin is an animal parasite medication. It does not work. It does not have any impact whatsoever on COVID-19. However, the side effects, because it's an animal medication against parasites, can be quite severe. And so it's not, so here's my consternation. Our vaccine trials enrolled tens of thousands of people, closely followed all the evidence very, very strongly in support of safety and effectiveness. And people question that, but they will go and try a medication that actually has been shown not to work. Hydroxychloroquine does not work by clinical trials, and ivermectin is an animal parasite medication. It is not safe for human consumption and has no impact on COVID-19. And so I'm surprised that people would use totally unproven things like that, and won't trust proven things. It's just an interesting thing to me. But I think it's really, really important for you to identify that if a medication and a potential medication has not been subject to an appropriate clinical trial, you need to be very, what's the right word? Cautious. You need to be cautious about that, and make sure that you look at the right data. Is it from CDC? Is it published in a really high profile magazine? Was it peer reviewed by lots and lots and lots of scientists, so they can help make sure that it's very, very true? These two medications do not work. Now, I understand there is an antiviral, which is very specific against viruses, that is in development, that they're very excited about, that might actually be something that we can use against COVID-19. They did try some of the medications that are used in HIV, which is a virus, obviously, and they did not work either. So again, they were subject to clinical trials. Remdesivir really has been shown not to make a big difference. So please, when you look at these things, yes, we try them in those who are on death's door because there's no other alternatives, but truly you don't want to harm. And these unproven therapies do harm. So thank you very much for asking that question. I see there's something here about ivermectin. Ivermectin in very small doses is used in humans in a different way. So there's a special dose for it that is used against human parasites. But the animal doses are the ones that have been and high doses of ivermectin are the ones that have been looked at. So not the high doses. Yes, ivermectin is used in parasites, small doses in humans. So thank you for that clarification. I should have done that. Yes, so good. Mite infestation, yes. So sorry about that. The small doses that we use for a known indication is perfect. The animal doses that have been proposed for COVID-19 are not safe. So thank you for doing that. So no, it's not dangerous if you're pregnant or breastfeeding to get the vaccine. They've already done the studies. They've looked for it in the antibody, in the breast milk. The babies look great. They're doing follow-up on babies who have been born to women who are pregnant who got vaccinated. No indication, no issues at all for that baby. And the other thing that's really positive about the babies of pregnant women who got a vaccine is that they have antibody when they're born. And so they're protected for the first 3 to 4 months from getting COVID, which is really, really cool. And then their mothers don't get really sick, because they can get really, really sick and actually lose babies. There's a fairly substantial rate, I don't know it off the top of my head, for miscarriages for pregnant women who get COVID-19. And again, breastfeeding, same thing. They've not identified that it's any active ingredients whatsoever in the breast milk. And so, and the antibodies from the mother do get in the breast milk, which is really, really cool. So again, another real positive for pregnant or lactating women to get vaccinated, because it'll help their babies too. So thank you for that question. That's a really good question. So I love this because you guys have had tons more questions than the faculty did when I did this. So I really love it. I'm going to look at my notes here just to see if there's anything else I wanted to mention. I just want to reaffirm to you that this vaccine is safe. Well, I think it's actually 380 million doses have been given in the US, carefully following a number of people, very rare side effects. The side effects from the virus itself are much more severe. And so this is a really, really good way to protect you and protect everybody around you. I really recommend it highly. I think it's extremely safe. And you ask great questions. So, I see that one. Why the push for mandatory vaccinations? Okay. I think you probably can answer this yourself. Without mandates, how many people will get vaccinated? We have lots of excuses, and I've used them as well if I'm late for something. Right, I didn't have the time. I didn't think it was such a big deal. So when we need high levels of herd immunity, like we need over 80% of our population to be immune to COVID-19 before we're gonna have any normalcy whatsoever, then mandates happen to be the one thing that makes a difference. So why do school children have a 95 to 96% rate of full vaccinations? Because it's mandatory that you get your vaccines before you go to school. And that's why they have that kind of rate. And when they have those kind of rates, they don't get outbreaks in school like they used to. So mandates are, do we like to use them? No. It's a thoughtful approach, very thoughtful approach. But for COVID, it was just way too slow to get us to that 80% where we can have a more normal world. So mandates can really be effective that way. And I know people don't like them, but that actually works. Okay, so the virus can last a little, not very long, unless it's covered in mucus. So if you consider a cough, all right, so let's say you have COVID and it's an active infection and you cough. So how far do those particles go out? About 3 to 4 feet, mainly about 3 feet. And then the particles, much less, the heavier they are, the faster they drop, of course. So a lot of the viruses will come out in secretions like mucus. And can they live in mucus for a while? Oh yeah, they can. So why do you suppose they say, wash your hands, like when you touch surfaces, wash your hands, don't touch surfaces, because things might have landed on it. But this is true of every single respiratory virus that we know, every single one of them. RSV, influenza, respiratory adenoviruses, all of them, is they land. And so they can be transmitted via hands to nose. Doesn't appear to be a huge way of being transmitted for COVID-19, but masks also help with that because you can't get to your nose and it's hard to get to your eyes. And so, so they can stay for a while, not very long. As soon as they dry, they're inactivated. So, but that's why that consideration of washing your hands, cleaning the surfaces, doing your little hand thing, that will really help keep you healthier because there's a potential for it living for a short period of time outside the body. All right. We're getting very close.
Perfect. Well, thank you everyone for your thoughtful questions. And thank you, Dr. Larson, for sharing your information with us and allowing us to ask questions. We really appreciate your expertise and your time. If you need up-to-date COVID information from Great Basin College, you can check it out on our website. I will put it in the chat. And we all hope you stay safe and healthy and take care.
Thank you all. I appreciate all your attention and all your questions. Be safe, please.